Hello, everyone. My name is Ashley Busuttil. It's an honor to be here today. Thank you to the ACP California Region 3 leadership for inviting me here to speak to you on wellness. I'll start with a brief introduction of myself. I work at UCLA, where I've actually spent my whole career. Following an internal medicine residency and chief residency, I joined the UCLA Department of Medicine faculty as a full-time hospitalist. And over the following years, I became involved in quality improvement, clinical operations and administration, first for my hospitalist group, and then at the level of my department, and ultimately at the level of the hospital. Currently, I am the Chief Medical Officer of Ronald Reagan UCLA Medical Center. And in that capacity, sort of broadly speaking, I oversee issues around the quality and safety of all the clinical care we deliver, as well as the professionalism, health, and well-being of our medical staff. And in addition to that, I still spend about 8 to 9 weeks per year on the internal medicine inpatient teaching services at Ronald Reagan Hospital and remain quite involved in trainee education. Really, the clinical care of patients and working with our resident trainees and educating them is what I was trained to do, and it is definitely a passion. So I'm often asked, how did I find myself in this position? How did I get here, essentially? And really, I've never been the kind of person who knew exactly what they wanted to do with their career. I didn't necessarily have some, roadmap several years out. Rather, and this is just me personally, I tend to say yes to a lot of opportunities. And then what I've done is followed the experiences that ultimately I found fulfilling. And also, I've been very lucky to have had wonderful mentors whom I admire personally and professionally. I'm a problem solver by nature. So ultimately, activities such as quality improvement and working to enhance the health and well-being of patients and colleagues alike really draws me in. And of course, what augments my career is the rest of my life. I have many boys in my life. The oldest, Leo, is 14. He is an introvert, and he tends to speak, 10, 20 words per week, maybe. But that's okay, and I'm working on really trying to embrace that silence and let him thrive within it. Alec is 11, and he is 100% on the other end. The child never stops talking, and he's hilarious. The youngest boy, arguably my most prized child, is Cody, who is a 2.5-year-old rescue border collie mix, and let me tell you, he is a handful. And last but never least, my husband, Derek, who is not a doctor and in fact, nowhere related to the medical field, and he just sustains me in so many ways. So that's a bit about me. But today I was asked to speak with you all about wellness, which is the theme of this entire event. And I'm not an academic expert on wellness. I haven't published on it, et cetera, but I've certainly read plenty about it. And as a person, like all of you, in this often rigorous and very challenging field of medicine, I've spent time all along the spectrum of well to unwell, and I'm really honored to share some of those experiences with you and the perspectives that they have given me. The promotion of our own health and well-being as providers of care is really essential to our ability to promote the health and well-being of our patients. Just as we've realized that as providers, we cannot rely on simply treating disease, right? But we must promote health in the populations that we serve. We must also promote our own well-being to minimize burnout, right? Because burnout in that scenario is really the corollary of disease, right? And the literature is very clear that burnout is associated with physicians leaving the medical field early, and often in a way that is, disproportionate among different groups. So for example, certain physician specialties may have higher rates of, early retirement, or certain demographic groups, women over men, et cetera. So, and I should say, it is also clear that burnout is 100% correlated with poor patient outcomes. If we are unwell, if we are burned out when we are in the workplace, we have worse patient outcomes. So we really have this circle in which our own well-being and that of our patients are really inextricably linked. So when I think about my own journey and the ways in which I have either struggled or thrived with wellness in my life and career, What I want to propose to all of you is that a successful foundation of wellness involves the intersection or Venn diagram of three components: the individual, me, you, whomever. Second is workplace culture, which is really the product of the group or community. And third, policy. So I'm going to talk to you about each of these in turn. And as I do, I will use examples from my own journey, not because my anecdotes are necessarily what others are going through, but because I think it's important that we foster normalcy in the struggles that we have. And I think there's some benefit and value to opening up about our own individual experiences, at least for those of us who feel comfortable doing so. So number one, the individual. There's a component of wellness that is really contingent upon each of us looking within ourselves. We have the responsibility to do some introspection, an introspection that is beyond our objective or external accomplishments, beyond, your so-called developed SMART goals, beyond, I reached such and such faculty position or got such and such award. But I'm talking about really identifying our own unique strengths and our own unique struggles or needs in our journey to wellness, right? And that kind of introspection can be scary. But by doing that, the results are really twofold. One, it will help put some concreteness to what may be required for each of us as individuals to be well. And everyone is different. So those needs could be exercise or sleep or changes in a relationship or a tutor or help with childcare, mental or physical medical attention, or anything else. It could be more ethereal, it could be very concrete. But each of us is different. And no one can better identify our own needs than ourselves looking within. So the second thing that may result is an acceptance for ourselves of who we each are. And if we are honest about looking ourselves, we may identify differences and strengths that actually can be celebrated and can add a lot to the diversity of our workplace. One example of many in my own life that took me some time to discover was the recognition and acceptance of my own sensitivity and emotionality, actually. I am a person who feels a lot. I am, as my husband would say, like an equal opportunity carer. I care about everything, okay? And I also like to joke around, and I do not have a Zoom poker face, okay? And I'm on Zooms a lot within my hospital administration. And I question myself a lot as a person. That's just part of who I am. And as I started to get involved with hospital administration, I questioned if I should really sort of temper, myself, temper my emotionality, be a little less me. But over time, and with really looking inward and understanding some of my traits a bit, I actually began to think that maybe I can contribute most in this job because of that sensitivity and emotionality, not in spite of it. And that acceptance was really a step forward in well-being for me and building a calm, productive work environment for myself. Because I don't think I would have been happy or as effective if I was trying to be someone who I was not. I do not need to emulate the strengths of my peers. I can recognize and admire those traits and incorporate some pieces in how I want to grow and change, right? But my own strengths are what define me. And frankly, that process of intentionally looking inward has been very important for me, really in all the roles I have in my life, as an administrator, as a teacher, even as a mother, a partner. All right, so number two, culture. And by culture, I mean who we are as a community and what kind of an atmosphere we create and foster together. Personally, I believe that if we are going to promote a culture of wellness, it requires openness and inclusion. Because you can do all the productive introspection that you want, but if you don't feel that you are in an environment where the expression of your individual strengths, needs, interests are accepted and celebrated, well, then what is the point of the introspection in the first place, at least pertaining to the impact on work wellness? And there's an element here about connectivity, working towards an environment in which we're able to see and understand each other without judgment and without stigma, and with a celebration of differences, because that ultimately brings us together, right? To start this may be easier with peers than it is across generations, and that's actually a product of our specific field. I was recently in a work situation with a colleague who is younger than me, and she stated that she felt there was a profound cultural divide between generations in medicine. And the comment really sat with me. It's certainly true that different generations in any field have different experiences and perspectives, but medicine in particular comes from a long history in which self-care was not recognized because all of our energy was focused on our patients. The idea of a mission-driven vocation or calling for which many became their entire identity. And that is simply not sustainable, and it's certainly not compatible with building diversity. But unfortunately, not only has medicine historically promoted this idea of the vocation being the entire identity of a person, but it has also bred a culture of silence and stigma around anyone who struggles with that mold of an all-encompassing career. And it has definitely not embraced the real power and potential and humanism that is in openness and vulnerability. Now, as far as how to build this culture, I recognize that culture building is not easy. I recognize that there is no algorithm for that, but we must persevere with it nevertheless. And it's important, I think, to realize that we are all mentors and mentees. No matter where you are in your training or career, there is always someone who is looking up to you. And hopefully there is always someone you are looking up to. So we can all model this kind of rethinking about medicine for each other, and the culture will build. All right, number 3, policy. No matter how much self-awareness one has, no matter how outstanding your culture of inclusivity and openness is, there are absolutely very concrete policies and infrastructures that are necessary for healthcare worker wellness. When I first joined the faculty at UCLA, following my chief residency, and again, this was back in, the early 2000s. My first son, Leo, was 3 months old. And I don't know about anyone else out there who has had an infant, but it was a very hard time for me. And at least to my knowledge at the time, there were not really any lactation spaces for faculty. I remember 3 times per day trying to use the resident call rooms to pump. And now as a faculty member, I didn't have access anymore. So I was kind of like, hovering around the door, waiting for someone to open it up so I could get in. And the stress of it was awful. And frankly, it was a big contributor to when I stopped breastfeeding. So thankfully that has changed a lot at UCLA, but that's one example, of policy or infrastructure, whatever you want to call it, that is necessary. And medicine needs to keep working at it. Institutions need to keep working at it, right? We need novel work structures that consider all the issues around family leave. We need systematic ways of surveying faculty and trainees to learn about what they need for their well-being. And then we need to listen and develop interventions targeted at those needs, right? We need multifaceted institutional, programmatic support of justice, equity, diversity, and inclusion as a core mission. We need easy access to mental health and wellness programs that are well-resourced, not stigmatized, and have enough variety. So for example, novel peer support programs, as well as more traditional mental health models, such that we can meet the needs of different types of individuals. And even if those services exist at an institution, if people don't know about them, or they don't feel comfortable making use of them for whatever reason, there's still work to be done. And of course, there are many, many other things, that we need in terms of, building this infrastructure through policy. So to summarize, we need to build a future of medicine in which well-being is our foundation, okay? That will take really moving away from this historical assumption that you need to give your whole self to medicine, that if you are, fully committed, medicine should be your whole identity. That is simply not sustainable, it is not healthy, and it is not desirable. And instead, we should think about that term, whole self, and flip it on its head, right? Okay, so if we can normalize and destigmatize bringing our entire selves, and by that I mean our varied interests, our hobbies, our experiences, our humor, and yes, our sadness, our insecurities, and our struggles, if we are allowed to be open with all of that, it will actually allow us to be truly outstanding humanistic doctors and colleagues. And it will make it a heck of a lot easier to thrive in this career. And it will take a lot, right? It will take from each of us individually, to the community we make up, to the building of policies that will sustain us and make all of that possible. But obviously, the very fact that well-being has gained such a footing in our lexicon The fact that ACP is putting on this entire event, is a start. We are on the path. And certainly it will be of benefit not only to us as clinicians, but to our patients as well. So thank you so much for taking this time. And I hope you all enjoy the rest of this program.